9 Signs and symptoms of irritable bowel syndrome. Irritable bowel syndrome affects between 6 to 18% of people worldwide. This condition involves changes in frequency or form of bowel movements and lower abdominal pain. Diet, stress, poor sleep and changes in gut bacteria may all trigger symptoms. However, triggers are different for each person, making it difficult to name specific foods or stressors that everyone with the disorder should avoid. In this video, I will discuss the most common symptoms of irritable bowel syndrome and what to do if you suspect you have it. 1. Pain and cramping. The most common symptom of irritable bowel syndrome is lower abdominal pain that is less severe after a bowel movement. Dietary modifications. Stress-reducing therapies and certain medications can help reduce pain. 2. Diarrhea. Frequent loose stools are common in irritable bowel syndrome and are a symptom of the diarrhea predominant type. Stools may also contain mucus. 3. Constipation. Constipation is very common. However, abdominal pain that improves after a bowel movement and a sensation of incomplete bowel movements after passing stool are signs of irritable bowel syndrome. 4. Alternating constipation and diarrhea. About 20% of patients with irritable bowel syndrome experience alternating periods of diarrhea and constipation. Throughout each phase, they continue to experience pain relieved by bowel movements. 5. Changes in bowel movements. Irritable bowel syndrome changes the time stool remains in your intestines. This changes the amount of water in stool, getting it a range from loose and watery to hard and dry. 6. Gas and bloating. Gas and bloating are some of the most common and frustrating symptoms of irritable bowel syndrome. Following a low fermentable oligosaccharides, disaccharides, monosaccharides and polyols diet can help reduce bloating. 7. Food intolerance. Many people with irritable bowel syndrome report specific trigger foods. Some common triggers include fermentable oligosaccharides, disaccharides, monosaccharides and polyols and stimulants, such as caffeine. 8. Fatigue and difficulty sleeping. Those with irritable bowel syndrome are more fatigued and report less refreshing sleep compared to those without it. Fatigue and poor sleep quality are also related to more severe gastrointestinal symptoms. 9. Anxiety and depression. Irritable bowel syndrome can produce a vicious cycle of digestive symptoms that increase anxiety, and anxiety that increases digestive symptoms. Tackling anxiety can help reduce other symptoms. What to do if you think you have irritable bowel syndrome. IBS is diagnosed by recurrent abdominal pain for at least 6 months, combined with weekly pain for 3 months as well as some combination of pain relieved by bowel movements and changes in frequency or form of bowel movements. Your doctor may refer you to a gastroenterologist, a specialist in digestive diseases, who can help you identify triggers and discuss ways to control your symptoms. Lifestyle changes, such as a low fermentable oligosaccharides, disaccharides, monosaccharides and polyols diet. Stress relief. Exercise, drinking plenty of water and over-the-counter laxatives can also help. Interestingly, a low fermentable oligosaccharides, disaccharides, monosaccharides and polyols diet is one of the most promising lifestyle changes for alleviating symptoms. Identifying other trigger foods can be difficult, as these are different for each person. Keeping a diary of meals and ingredients can help identify triggers. Probiotic supplements may also reduce symptoms. Additionally, avoiding digestive stimulants, such as caffeine, alcohol and sugary beverages, can reduce symptoms in some people. If your symptoms don't respond to lifestyle changes or over-the-counter treatments, there are several medications proven to help in difficult cases. If you think you have irritable bowel syndrome, consider keeping a journal of foods and symptoms. 10. Take this information to your doctor to help diagnose and control the condition.